Hello, friends. Welcome to today's session, and I welcome you all to my YouTube channel. My name is Beneath Rai, and I'll be trainer for today's session. And in today's session, we are going to learn about U.S. healthcare providers. Now, the screen that you are able to see is the main landing page or home page of our website, which is for Healthcare Business Analysis training. And before we start our today's session, I'd like to introduce ourselves. I'd like to mention about who we are, and then we can focus on our today's session. So we are basically a passionate professional dedicated to provide US healthcare, agile and business analysis training and consulting services. And as we know, a business analyst is a key figure in understanding business requirements and their implementation. We teach the fundamentals of US healthcare domain to the IT professionals or non-IT professionals who are passionate, to kickstart their career as healthcare business analysts. And basically, we provide training to the working IT professionals or US IT recruiters, quality analysts who want to kickstart their career as business analysts. Even we train the non-IT professionals who are aspiring to get into business analysis or healthcare business analyst role. Also, we train the IT business analysts who want to learn US healthcare fundamentals. And I've been repeating this US healthcare fundamentals. Basically, uh, we majorly focus on US healthcare domain, and our goal is to train and help the business analyst or non-IT professionals or IT professionals to understand the fundamentals of US healthcare domain so that they can give their best while working on various projects and implementations. So when we say US healthcare, as we know, US healthcare industry is one of the largest industries in the world, and it has direct effect on the quality of life of people in each country. Now, when we say healthcare, basically healthcare is the diagnosis, treatment, and prevention of disease, illness, injury, and other physical and mental impairments in humans. Now, when we talk about US healthcare, it's basically a combination of four major components, including finance, insurance, delivery, and payment, which makes it unique and qualitative in terms of providing healthcare, unlike any other country in the world. So, when we say what are the key players of US healthcare, so basically they are providers, your government, finance, insurance, uh, which we say payer, then members. Now, in today's session, we are going to work on and learn about US healthcare providers. So the question is, who are the providers? So healthcare providers or we can say it's a person or organization or institution that directly or indirectly provides healthcare services. They are termed as provider. So it can be physicians, dentists, doctors, hospitals, labs, pharmacies, any ambulatory services, which is ambulance services. So whoever is providing services to the members, or we say patients, they are being termed as providers. We never say patient, uh, they're termed as members. So providers are basically who are rendering services to members. And it can be physicians, doctors, hospital, anyone. Now, what kind of providers we have? What are the classifications we have in the provider? So we have individual providers who are not a part of group or association. They use their own tax identification number. Like individual doctor who has their own clinic and they render services. There are certain providers who kind of make a group, and then within one group there are more than one providers who work and they share a common team. So they are basically called as group or entity provider. Group of more than one provider using a common tax identification number. We do have IPAs as well, Independent Practice Association or Independent Physician Association, or we say provider organization. So basically they're a legal entity that provides administrative and contract related services for providers. Now, we have a participating provider and non-participating provider and opt-out providers. What are these participating, non-participating? So basically what happens, uh, there's a health insurance or payers. Basically, they contract or they make a contract with the providers. So a participating provider is one who has a valid contract with the health insurance to provide all covered services for all the Medicare Part B beneficiaries on an assigned B. We'll discuss more about what is Medicare, what are the different types of Medicare like Part A, Part B, Part C, Part D in our next lesson. But basically participating providers has a valid contract with the health insurance, and they agree to accept Medicare approved amount as payment in full. They may not collect, more than applicable deductible and coinsurance for covered services from patient or member. Payment for non-covered services may also be collected. Now, deductible, coinsurance, all these terminologies, I request you to refer to my blog, which is available at my website, and you can go through one of the blog where I have mentioned about the various terminologies that we use in US healthcare. I request you to go over that so that you can get accustomed to all these terminologies. Medicare payment paid directly to the provider, so they are participating provider. When we say non-par or non-participating provider, a non-participating provider has not entered into an agreement with health insurance to accept assignment on all Medicare claims, and they can elect to accept assignment or not accept assignment on a claim by claim basis. And they cannot bill the patient or member more than the limiting charge on non-assigned claims. So basically, the goal of US healthcare is today is to improve the quality of care and reduce the cost of care. Now, in order to fulfill this, quality of care should be improved and cost of care should be reduced. These health plans or health insurance companies, they do make a contract with the providers so that they can, all the members who has purchased the insurance from these payers, they are being referred and they go to the contracted providers so that these contracted providers can provide a better service. And these providers are highly motivated because they have a contract with the health insurance companies, and they get very good incentives and rewards, and they get paid their amount as per approved Medicare payment in full. So they're motivated enough. So that's where this participating provider kind of provide a good quality of care, and they try to reduce the cost of care. And there are various things associated with the agreement is there between provider and payer. Is like providers cannot perform certain services not medical required, which are not required, or if it is not necessary, then they don't perform such kind of services. And that's where there's a utilization management concept, which we are going to discuss in one of our sessions. Opt-out providers are basically, they do not accept Medicare at all and have signed an agreement to be excluded from the Medicare program. Now, there are provider classification where we are talking about various types of providers like facilities. So they provide facilities like wards, ICUs, for example, hospital, maternity home, equipment, providing equipment for the medical tests, like example would be labs. Suppliers provide, the medicines and the surgical instruments, like, for example, pharmacies. Preferred provider, they're contracted to furnish services or supplies for a negotiated charge. Non-preferred provider, not contracted to furnish services or supplies within preferred network. PCP, and again, this is one of the terminology which I have already described or mentioned in my one of the blog. A primary care physician or primary care provider is a person you may see first for checkups and health problems. And there are various health insurance plan there in the US healthcare, like health maintenance organization, HMOs, preferred provider organization, PPOs. And that's where we'll understand how the members are required to first go and see their PCPs, why they cannot go and see the specialist, what are those different plans in which they are required to go and see their PCPs first. And there are certain plans which doesn't require them to visit their PCPs. They can visit any of the specialists within their network. So we'll talk about all these things in our next lesson. We have specialists. PCP may refer you to a professionals in various specialties when necessary, such as allergy and asthma, cardiology, internal medicine, etc. Now, there is a term called NPIs or National Provider Identifier. So the National Provider Identifier is a health insurance portability and accountability administrative simplification standard, which we say HIPAA standard. So we'll discuss about HIPAA in one of our next lesson. The NPI is a unique identification number for the covered healthcare providers. When we say covered healthcare providers, so covered healthcare providers and all health plans and healthcare clearinghouses must use the NPIs in the administrative and financial transactions adopted under HIPAA. NPI is a 10-digit intelligence-free numeric identifier. This means that the numbers do not carry other information about healthcare providers, such as the state in which they live or their medical specialty. CMS, Centers for Medicare and Medicaid Services, has created an online NPI registry where a physician or other healthcare providers or organization can access their NPI information. Now, to obtain your NPI, we can visit nppes.cms.hhs.gov. I was talking about provider network earlier. So provider network, what is a network? What is in network? What is out network? So in network or network, so first we'll discuss about what is the network. Health maintenance organizations deliver comprehensive medical care to plan members by entering into a negotiated contract with the providers to form a network. Now, the facilities, healthcare providers, and suppliers that your health insurance plan has contracted with to provide services, they are basically called as in-network providers. So, as a member, you pay less for the healthcare services received in-network and services received out of network. When we say out of network, a facility, healthcare provider, and supplier that doesn't have a contract with your health insurance plan to provide care to you. You'll pay more for healthcare services received out of network than services received in network. So when the payers or the health insurance companies make a contract with the providers, there's a provider network management comes into picture. And in order to bring a provider into a contract, or if provider is willing to participate with the health insurance companies, they have to follow various steps. Like the first thing that they do is provider credentialing, then provider contracting, provider maintenance, and then provider reimbursement. So when we say provider credentialing, we validate whether provider possesses the necessary education, license, and training to supply healthcare to consumers. Provider contracting, once provider credentialing is done, the defined contractual agreement between payer, when we say payer, it's health insurance companies, and provider related to reimbursement for services, risk sharing, and incentive payouts. So there's a traditional payment approach, fee for service, and there's a capitated amount based on value-based care. And after Obamacare, the latest payment models, there are various payment models present in the market, where one of the term is used as capitated money, where providers enters into an agreement with the health insurance companies that they say a health insurance company will be paying them per member per month certain amount, and that is called as capitated or capitation. So fee for service is different than this capitation amount. So that's where in the provider contracting, they come with an agreement between payer and provider related to reimbursement for services. Provider maintenance, maintain and manage the provider's data, demographics, and fee schedule information. Also includes provider customer service and providing provider call handling. Provider reimbursement, once the provider is done rendering a services to the members, they claim to the health insurance companies. So in the provider reimbursement process, they receive claims or encounter forms. If it is professional, they receive CMS 1500. If it is institutional claim, they receive UB04. So they receive claims and counter forms from provider and reimburse them for the services delivered based on the terms of their contract. So this is what they do in the provider network management. Provider referrals. Now, provider referral is an order written by your provider for you to see another doctor, therapist, or specialist. Provider referral is most commonly known as referral, but only refers to the written recommendation of a medical professional. For example, if you get a referral to ophthalmology, you are being referred to see an eye doctor. In most HMO plans and other managed care plans, a referral is usually necessary to see any provider or specialist other than your primary care physician if you want the service to be covered. This type of order referral is usually issued by your PCP. So this is about provider referrals. So this is a high level information about US healthcare providers. We'll be discussing about various fundamentals of uh, US healthcare terminologies. We'll discuss about fundamentals of US healthcare domain in our upcoming sessions. I hope this session was helpful for you just to understand who the US healthcare providers are, what exactly they do, what is the concept of network in, network out, network, what is NPI. So that was our uh, goal, and I hope you were able to understand. You can visit our YouTube channel, that is at K Beneath Rai Blogs YouTube, and you can also read my blog, which is posted at healthcarebusinessanalyst.com, where we post various blogs based on business analysis, agile, scrum, product owners, fundamentals of US healthcare domain. That is our goal. You can also send an email to kbenithrai@gmail.com, and we'd be happy to help you and assist you for any of your questions or issues. I hope this session was helpful. Your comments and your feedback is very much appreciated. I request you to go through my blogs. Feel free to share your comments. If you like my videos, feel free to click on subscribe button. You can hit the bell icon so that you can receive the latest notification. You all have a great day. Looking forward to make another videos for you, and we'll see you there. Thank you very much.